Yeah, in our next story, we're going to talk about the Dems and their embarrassing plan for healthcare in the budget. Uh, so, how much healthcare can Democrats cram into their $3.5 trillion package? A combination of money and politics likely means party leaders can't do everything they and their supporters want. If that just doesn't sum it up, combination of money and politics. What's the real problem here? We're going to continue though. Healthcare policy has not been the kind of preoccupation it was during the first year of the last two Democratic presidencies. This is very much intentional. Nobody in this White House wants a brutal, protracted fight over health policy with so many other urgent items on the agenda. Almost nobody on Capitol Hill wants one either. So many other urgent items on the agenda. 45,000 people a year die because they do not have access to basic health care. Urgent items on the agenda. Sure, there's plenty. Sure, there's plenty. But 45,000 lives that you could save by implementing a universal healthcare system, and you just don't. Nobody in this White House wants a brutal, protracted fight. Nobody on Capitol Hill wants one either. And notice how it doesn't say anything about the people or the base, or the people that are affected, the families that are affected by the 45,000 people that die every year. Drill that number in your head. I want all these politicians to just tattoo it on their arm. No, it's their fault that they could be doing something and they choose not to. So we're going to continue. But President Joe Biden and his allies in Congress understand that it's still a lot of unmet need out there, even with the Affordable Care Act fully in place, and they have some ambitious ideas for addressing those needs. The problem, as always, is funding. Every big idea comes with a big price tag, and somehow it is all fit into a giant spending bill that includes the rest of the Democratic agenda and can still get through Congress. So, the universal health care plan, um, when it's implemented, will be a giant bill. Um, they say that universal health care will cost $3.26 trillion in 10 years. This 3.5 trillion isn't even close. It's not even close to what universal health care would actually cost. Those are the actual numbers. $32.6 trillion in 10 years. So, but the thing is, that number is slightly misleading because it actually net saves the American people money. Because if you consider, and we'll go into it, but you consider how much hair costs on a private level, you pay it saves the American people $2 trillion in over those 10 years. You look at all the costs, and we're going to look at all the costs here in a second. So, Democratic leaders have tentatively settled on a package of 3.5 trillion spending over the next 10 years, which is both a lot of money and still not enough to do everything Democrats want. They have to downsize some ideas one way or another and maybe jettison some altogether. And this is the problem with the Democratic Party, that they are still beholden to the for-profit industries, the party as a whole, and why the progressive movement is fighting so heavily against it. Because there should be no downsizing. There should be no eliminating. There should be this is the plan. Sign on or get out of the way. Universal healthcare is that important. It's that important of an issue. As we said before, over 60% of the American people support some type of universal healthcare. Over 50% of Republicans support some type of universal healthcare. So, well, we're going to go into these studies of why it's always about money, but it's never It's never about people. It's always about money, but it's never about money when it comes to these for-profit industries making a ton of it. And so, um, healthcare costs over the next 10 years are projected to be $59.4 trillion. That's with private insurance and Medicare costs altogether. Now, if it was just a Medicare for all system, it would take it down to $57.6 trillion over the next 10 years. Now, why does it cost so much? Why do people who have privatized medicine usually pay twice as much as people who have Medicare? Sometimes more, at least twice as much. Why? It's because the for-profit industries are taxing you left and right. There's so many middlemen, gangsters in the healthcare industry. First one is obvious. It's the private insurance companies. It's people that you get your insurance from. They're a middleman. This is something that you could that there's no reason for. Like the movie John Q. Sick help. That's as easy as it should be, but it isn't because these for-profit middlemen have a lot of red tape. So premiums for private insurance totaled up to be $968.3 billion in just 1 year. Now, as I said, that is double the rates of Medicare patients. Double. So and the care is the same. You know, I have Medicare, at least for a little while, and I feel like it might take. Sometimes it takes a little bit more, and sometimes you do have to settle, for generic drug prices and you know, things like that, or maybe have to travel a little bit farther to go to a different hospital, which is ridiculous and complete garbage that hospitals can deny you because you have Medicare. But when it comes to the care, I've never received care that I didn't believe was adequate. Speaking of drug prices, that would be the second for-profit middleman that is taxing the American people, Big Pharma and the pharmaceutical companies. When it comes to profit, when it comes to revenue received, two different things. But when it comes to revenue received, Big Pharma and the major pharmaceutical companies received 1.05 trillion, over $1 trillion in a year worth of revenue. And over half of that came from the United States and Canada. But when it comes to our prescriptions, they make bank off of us because we pay double what Canada pays for any prescription. And under the European system, we pay about 3 times as much. The government has no laws set up in place to even barter with the companies. They can charge whatever they would like, and there's nothing we could do to stop them. How does that make any sense? Medicare can barter. Private insurance, they're in cahoots together. And lastly, but definitely least, last and definitely least, is even the private physicians. These people have to pay exorbitant fees just to maintain their business. And I'm not saying that they're doing it for selfish profit reasons, because it takes about $500,000 to run a private practice. So that's a lot of money. You think, oh, $500,000. But when you think about administration costs, and even the debt that they're paying off, still, they only have a profit margin of about 15%. And I'm not saying the doctors shouldn't be paid. system, but the system doesn't pay them. The system is completely broken because even when the system is broken, even the individuals suffer. They can't even profit off of it. Like they have a hard time profiting off of it, and they should make a profit. Doctors should definitely make a profit because they do good work. But that's an issue. Why why is this happening? And to make matters worse is we pay so much, and we are one of the worst healthcare system. We have one of the worst healthcare systems in the world. We have, when it comes to the modernized world, when it comes to modernized nations, we have, it was 13. We have 13 out of 13 when it comes to our medical system. Our disease burden rate, which is basically when you have premature death or you're living with disability, is number one. That's the one thing we're great at, is our people dying young and being injured. The number go USA. But we're last in healthcare access and equality and quality. So this idea, what Joe Biden's really trying to get popped off is an expansion to Obamacare, because he doesn't support Medicare for all. He said as much, that he doesn't want Medicare for all. He's not fighting for it. He's not really fighting for anything. But he wants to expand Obamacare to include dental and vision and just get more people on Medicare, which is applaudable, but not going to win me over. It's not going to. It doesn't impress me. Not in the slightest. You're doing the bare minimum, just so you can say you did a lot when you didn't. You did a little. Because Obamacare, at the end of the day, is a big payout to the insurance companies. You're still supporting the private insurance companies, for-profit middlemen. Still part of the problem.